Good morning, class. Today we are starting a new and very important topic in our health unit, sexually transmitted infections, or STIs. Before we begin, I want to set some ground rules. This is a safe space to learn. There are no silly questions here. Everything we discuss today is about health, the same way we'd talk about the flu, dengue, or any other illness. We are going to talk about facts, not gossip, about health, not judgment. Over the next 2 weeks, we will cover 2 big ideas. First, we'll learn what STIs are, how they spread, and why they matter. Second, and this is the part one really want you to remember, we'll learn how to protect yourselves and the people you care about. I want everyone to listen with an open mind, take this seriously, and remember, understanding your health is a sign of maturity, not embarrassment. Let's look at what we're aiming to learn by the end of these 2 lessons. I've grouped our goals into 2 columns, understanding STIs and preventing STIs. On the left, under Understand STIs, by the end of this unit you should be able to define what an STI is in your own words, name common types of STIs, explain the different ways STIs can spread from one person to another, and identify the symptoms and health effects linked to different STIs. On the right, under Prevent STIs, you should be able to list the ways and strategies we use to prevent STIs, explain why sex education, like the lesson we're having right now, is so important, understand what barrier methods, like condoms, are and how they help, and explain why regular testing and honest communication matter. Keep these 4+4 goals in mind. We'll come back to them at the very end of the unit so you can check your own progress. Before we go deeper, let's make sure we all understand the vocabulary we'll be using throughout this unit. I'll read each term, and I want you to repeat the full form after me. This will help it stick. STD stands for sexually transmitted disease. This is an illness that spreads through sexual contact. STI stands for sexually transmitted infection. This is also spread through sexual contact, but notice the difference, an infection can be present even when a person shows no symptoms yet. That's why health experts today usually prefer the word infection over disease. It's more accurate. HIV stands for human immunodeficiency virus. This virus attacks the body's immune system, the system that normally protects you from getting sick. HPV stands for human papillomavirus. This is linked to genital warts and can raise the risk of certain cancers. AIDS stands for acquired immunodeficiency syndrome. This is the most advanced stage of an HIV infection, when the immune system has become very weak. Now that we know the term, let's really understand what an STI is. An STI is an infection that passes from one person to another through sexual contact. It's important to know that STIs can be caused by 3 different kinds of germs, bacteria, viruses, or parasites. Because of this, some STIs can be cured with medicine, while others can only be managed, not cured. We'll see examples of both later. STIs can affect anyone, both males and females, people of any age, background, or lifestyle. This is a health issue, not a moral one. Here's something very important. Some STIs cause noticeable symptoms right away, but many STIs show no symptoms at all, especially in the early stages. Doctors sometimes call these silent infections, because a person can carry and unknowingly spread an infection without feeling sick. Here's an analogy that might help. Think about how a common cold spreads when people are in close, everyday contact, sharing a room, coughing near each other, touching the same doorknob. An STI works in a similar way, except it spreads specifically through sexual contact instead. This silent infection idea is exactly why the second half of our unit, prevention and testing, is so important. You can't always tell just by looking or feeling fine. Let's break down exactly how STIs move from one person to another. There are 4 main routes. The first is sexual contact. This includes vaginal, anal, or oral sex. This is the most common route for STIs. The second is mother to child. Some STIs can pass from an infected mother to her baby during pregnancy, during childbirth, or through breastfeeding. This is why prenatal checkups and maternal health care are so important. The third is blood. Certain STIs, like hepatitis B and C, can spread through contact with infected blood, for example, Sharing needles. This route isn't only about sexual activity, it's about blood safety in general. The fourth is skin-to-skin contact. Some STIs, like HPV and herpes, can spread through close contact with the genital skin area, even without full intercourse. For each of these four routes, I want you to think of one action a person could take to lower that specific risk. Let's go one by one. Now let's look at specific STIs, starting with ones caused by bacteria. The good news about bacterial STIs is that they are usually treatable with antibiotics, medicine that fights bacteria, especially when caught early. First, gonorrhea. This is caused by bacteria. Common signs include pain when urinating and unusual discharge. It spreads through unprotected sexual contact. Second, chlamydia. This is also caused by bacteria, but here's the tricky part, it often has no symptoms at all. A person can have chlamydia and feel completely normal. If it's left untreated for a long time, it can affect a person's fertility, their ability to have children in the future. Notice the pattern here. Gonorrhea tends to show clearer symptoms, while chlamydia often hides silently. This is exactly why regular checkups matter, even when you feel fine. Let's look at one more bacterial STI, syphilis. This one is a little different because it moves through clear stages over time. Syphilis is caused by a specific bacterium. It develops in 4 stages. First, painless sores appear, then a rash and fever develop. Then there's a hidden stage where there are no visible symptoms at all, and if it's still not treated, it can eventually cause serious organ damage. Syphilis can spread through sexual contact, through blood, such as a blood transfusion, or from mother to child during childbirth. Here's the key lesson from syphilis. Symptoms can disappear and then come back later, even worse. No symptoms right now does not mean no infection or it's gone. If untreated, syphilis can seriously damage the heart and nervous system down the road. This is another strong argument for getting tested regularly, rather than waiting for symptoms to tell you something is wrong. Let's move to STIs caused by viruses, starting with HIV and AIDS, 2 terms that are related but not the same thing. HIV stands for Human Immunodeficiency Virus. This virus attacks the body's immune system, the system that normally fights off infections and diseases for us. AIDS stands for Acquired Immunodeficiency Syndrome, and it is the most advanced stage of an HIV infection. It happens when the immune system has become severely damaged over time. So remember this relationship. HIV is the virus, AIDS is the stage a person can reach if HIV is left untreated for a long time. HIV can spread through sexual contact, through blood, or from mother to child during childbirth or breastfeeding. Here is something hopeful and very important. There is no cure yet for HIV, but modern medical treatment allows people living with HIV to live long, healthy lives. Many people with HIV today manage it like a long-term condition, similar to how someone might manage diabetes, through consistent medical care. I want to be very clear, having HIV is not something to be ashamed of, and people living with HIV deserve the same respect, kindness, and inclusion as anyone else. Let's look at 2 more viral STIs, HPV and genital herpes. HPV, or human papillomavirus, is actually a very common virus. It can cause genital warts, and certain strains are linked to a higher risk of cervical cancer. The encouraging news is that a vaccine is available for HPV, and it's one of the most effective prevention tools we have. Many countries, including the Philippines, recommend it for young people. Genital herpes causes painful sores or blisters, and it spreads through skin-to-skin contact. There is currently no cure for herpes, but it can be managed with medicine that reduces outbreaks and lowers the chance of spreading it to a partner. Notice something important across both bacterial and viral STIs we've discussed. Bacterial infections like gonorrhea, chlamydia, and syphilis are usually curable with the right antibiotics, but viral infections like HIV and herpes currently have no cure, only management. That difference is exactly why prevention is so valuable. Preventing an infection is always better than needing to manage one for life. Let's step back and look at the bigger picture with some global statistics. I want you to really sit with these numbers for a moment. Every single day, more than 1 million new STIs are acquired by people around the world. That's every day, not every year. In 2020 alone, there were about 129 million new cases of chlamydia and 82 million new cases of gonorrhea worldwide. As of 2016, more than 490 million people globally were living with genital herpes. Why am I showing you these huge numbers? Not to scare you, but so you understand something important. STIs are an extremely common global health issue. They affect people across every country, culture, and background. This is not a rare or shameful problem that happens to other people. It's a normal part of public health that deserves the same serious, respectful attention we give to any other widespread illness. So instead of stigma or embarrassment, what these numbers really call for is understanding, prevention, and honest conversation, exactly what we're doing right now. We've spent our first session understanding what STIs are, how they spread, and how common they really are. Now let's shift gears completely and talk about the good news, prevention. Here's the big idea I want you to carry into the rest of this lesson: STIs are common, but many of them are preventable. Knowing the facts, like we just learned, helps you make safe, informed choices for your own life. And when you protect yourself, you're also protecting the people you care about, now and in the future. Before I show you the next slide, let's think together for a moment. Now that we understand how STIs spread, what do you think we can actually do to protect ourselves? Any guesses? Great thinking. Let's see how many of those ideas show up on our next slide. Let's go deeper into two of the strategies we just introduced: barrier methods and mutual monogamy. Barrier methods are physical tools that create a barrier, literally blocking the exchange of body fluids during sexual contact. Condoms are the most well-known barrier method, and they lower the risk of spreading many STIs. Dental dams are another barrier method that can help protect during oral sex. Mutual monogamy is a bit different. It's an agreement between two partners to be sexually active only with each other. This strategy reduces risk, but only under one important condition: it works best when both partners are confirmed free of infection, usually through testing. Mutual monogamy is about trust and honesty working together with health information. Notice that barrier methods are a physical, medical strategy, while mutual monogamy is a relationship-based, trust strategy. Both can reduce risk, but again, remember that abstinence remains the only 100% guaranteed method. Let's talk about one of the most important habits in STI prevention: regular testing. Regular testing catches STIs early, even when a person shows no symptoms at all. Remember our earlier lesson about silent infections? Testing is how we catch those silent cases before they cause bigger problems. Early treatment can cure many bacterial STIs completely, which is another great reason not to delay getting tested if you ever have concerns. Now here's something just as important as the medical side. Stigma, meaning shame, judgment, or unfair treatment, stops people from seeking help. If someone is afraid of being mocked or judged, they may avoid getting tested or treated altogether, which puts their health and others' health at greater risk. This is why kindness genuinely saves lives. Everyone deserves access to healthcare and fair, respectful treatment, no matter their health status. This includes classmates, family members, and anyone in our community. I want you to walk away from this slide with one commitment. If a friend or classmate ever confides in you about a health concern, respond with support, not judgment. Here are 5 key strategies for preventing STIs. Let's go through each one. Number 1. Abstinence. This means choosing not to have sexual contact at all. It is the only method that is 100% effective at preventing STIs, because if there's no sexual contact, there's no route for that specific type of transmission. Number 2. Vaccination. As we mentioned earlier, vaccines exist for certain STIs, such as HPV and hepatitis B. Getting vaccinated is a proactive, medical way to build protection in advance. Number 3. Condom use. When used correctly and consistently, meaning every single time, condoms greatly lower the risk of many STIs. The key words here are correctly and every time. Number 4. Communication. This means having open, honest conversations with a partner about STI testing and sexual history. It might feel uncomfortable, but honest communication is a powerful protective tool. Number 5. Education, which is exactly what we're doing right now. Knowing the facts about STIs helps you make wise, informed decisions rather than decisions based on rumors or misinformation. I want you to notice something. These 5 strategies work best together, not as competing options. Think of them as 5 layers of protection, not 5 separate choices you have to pick just one from. Before we move to reflection, let's do a very quick oral check to see how well these ideas have stuck. Question 1. What strategy means avoiding sexual contact completely? Pause for answers. That's right, abstinence. Question 2. Which virus attacks the body's immune system? Pause for answers. Correct, HIV. Question 3. Name one reason why regular STI testing is important. Pause for answers. Great answers. Testing catches infections early, even without symptoms, which allows for early treatment. Nice work. The full written formative assessment, with more identification questions, is on your separate assessment worksheet, which we'll complete individually. Now let's pause and reflect honestly on our own learning. I'm going to read 4 statements, and for each one, I want you to privately rate how confident you feel: super sure, pretty sure, or still learning. You can show me with a hand signal, write it in your notebook, or use a sticky note, however we've set it up in our class. Statement 1. I can explain what an STI is. Statement 2. I can name ways STIs spread. Statement 3. I can list ways to prevent STIs. Statement 4. I understand why kindness and honesty matter. There's no wrong answer here. This reflection helps both you and me understand which ideas might need a bit more review before our next assessment. We've covered a lot over these 2 lessons, so let's bring it all together with a final recap. First, STIs spread through sexual contact, blood, mother-to-child transmission, or skin-to-skin contact. Second, common STIs include HIV, HPV, gonorrhea, chlamydia, syphilis, and herpes, some caused by bacteria and usually curable, others caused by viruses and only manageable. Third, prevention includes abstinence, vaccination, condom use, communication, and education, 5 strategies that work best together. Fourth, testing early and treating others with respect leads to healthier communities for everyone. I want to close with this thought: stay informed. Stay safe. Take care of yourself and others. Understanding your health and the health of the people around you is one of the most mature and caring things you can do. Thank you for engaging so thoughtfully with this topic. If you ever have more questions, now or later, you can always come talk to me privately or reach out to the school nurse or guidance counselor.